Well, hello, everyone. We are honored today to be joined by Dr. Joya Hampton-Anderson. Dr. Hampton-Anderson, thank you for being here with us today. How are you?
I am doing great. Thank you, Dennis. Thank you all for having me.
Now, let's just get right into it. I just want you to spend some time speaking to us and the supporters about your research and what you're doing right now.
Absolutely. So over the years, my research has focused on stress and how it impacts health outcomes in African American youth and families. And what I noticed is that many of the families that I work with, or the children that I work with, had a lot of anxiety and stress-related disorders in addition to the health complications that they were experiencing. So moving along kind of my graduate school career and then moving into postdoc, I really wanted to delve into treatment of some of these stress and anxiety related disorders that I saw were mostly being untreated in African American youth in particular. So part of my work during this year being funded by AIM has been to develop a stress and anxiety prevention program for African American youth. And what I'm really interested in is taking our evidence-based practice for, how we know to treat anxiety and pairing it with a lot of culturally relevant treatment factors that we know are protective against a lot of mental health outcomes for African American youth in particular. So for example, racial identity issues, race socialization issues, merging those two together to see if we can have effective treatment outcomes for these youth. And I think a program like this is very important, particularly now when we are experiencing heightened stress kind of nationwide, because we know that people of color are often disproportionately impacted by such events.
Yeah, and it's interesting, the times that we're in right now, and you talk about stress and you talk about the cultural part of it. Speak to me more about, where does that kind of stress, where does that stress kind of come from? I can remember growing up young and just, I could feel the stress in my household because of the things that were going around in the world. Now, with the Black Lives Matter thing, I think it's we're starting to see more of this. How does this affect a young African-American child growing up in today's world?
Sure, absolutely. So the research literature really highlights the impacts of oppression and marginalization, right? So we know that African Americans have a unique history in the United States in that we are descendants of the transatlantic slave trade. We have been subjected to policies and systemic procedures that disenfranchise, right? So that leads to a lot of outcomes like food insecurity, difficult neighborhood context, and a lot of other things that are experienced as stressful disproportionately for African Americans and other youths of color. So that is when you grow up in that type of context, that is stress in itself. And then when you pair that with instances of discrimination and racism that African American youth often experience, you have this cumulative impact of stress. That can lead to disproportionate amounts of mental health disorders such as anxiety and depression, but also physical health impacts as well. And we know that African Americans have disproportionate rates of various physical health concerns as well. So they really do go hand in hand.
And and how are you? How are you getting the message out? I think about my grandmother, my sister. There's always been a struggle as far as African Americans kind of reaching out for help. Can you talk more about how you are kind of getting your message out?
So there's kind of a two-part answer to that. The first is that I'm also a clinician. So I'm a clinical psychologist. So I do research and I see patients. The bulk of my caseload are Black and brown youth. Many youth who are very nervous about going to therapy for the first time, many youth whose parents don't want them in therapy, right, or not really seeing the value. So I feel like I'm doing a lot to kind of debunk stigma in my day-to-day clinical practice. And of course, within the therapeutic space, really leaving room for validation and normalization of a lot of the stressors that the youth I work with are experiencing, and how that, how we can work to make them better.
Hmm.
Second part of that question has to do with kind of publication of my research, and this is where AIM really comes in. So this year, for example, I recently co-authored a manuscript on the impacts of COVID-19 on Black Americans in particular. I've also published a lot of my work from graduate school focusing on African American youth and families. So the support from AIM really gives me the protected time to be able to write and publish my work. And in academia, the more you do that, the more of a platform you have to speak on some of these broader issues. So I'm really thankful for AIM support to do just what you highlighted.
I think, that is fantastic. I think as far as youth go, young African American youth, you got to start kind of grassroots, and get to these young people, young, and not become adults and have these different challenges. So, I mean, do you have any, personal experiences that you're willing to share?
The youth I work with are already experiencing pretty significant mood concerns. However, this year in particular, dealing with the impacts of coronavirus and the resurgence of recognition of racial injustice in the United States, that stress has been compounded. So many of my African American youth I work with are quite distressed about what they're seeing in the news, kind of what they're having to deal with their families and their friends, a lot of worry on top of their kind of baseline anxiety. So it has been really it's been impactful, I think, to work with the youth that I work with during this time in particular, and it really highlights the importance of the research program that I'm building.
Dr. Hampton-Anderson, it sounds like your research, which is great, it sounds like it's very tailored. Mm-hmm. But to talk about the research and the funding and how it's so important that your partnership with AIM.
Yes. So the research literature is really clear that positive racial identity development is very protective for mental health in African American children. And I work in a clinical setting with kids who experience pretty severe levels of anxiety and stressor-related disorder. So what I'm really interested in is pairing our treatments for anxiety with what we know about racial identity and race socialization. So what does it mean to be an African American in the United States, and how empowered do we feel about that, right? And pull those together to enhance treatment outcomes. What we know from the research literature is that African American youth are less likely to seek out mental health care and retain in treatment, right? So once they start coming to therapy, oftentimes maybe they don't see through the entire treatment course. And a lot of that is because of some of the lack of cultural relevance in the treatments that we already have. So what I really want to do is take what we know about culturally competent research and pair it with what we know about how to treat some of our more severe mental disorders, and hope to kind of increase treatment retention and for African American youth who are experiencing this increased stress and anxiety.
We know that funding's super important, and we know you're about to start up your research. How important is it to you with AIM getting your funding and starting your research?
Absolutely. So the funding from AIM this past year has allowed me protected time to do this work, right? So I have had time to write manuscripts. I have had time to think about the foundations of my program, think about how I want to promote this program. So without AIM, I would not have had the protected time to do that. And I don't think I would have been as far along as I am now going in as a faculty member. So AIM has really allowed me to lay the foundation for my stress and anxiety prevention program for African American youth that I hope will help serve the Atlanta community in the years to come.
All right, that's fantastic. And, this is my first year involved with AIM, but just speaking with you, I mean, you talk about a fantastic cause. And I think your research is going to make a huge difference, you know, especially with the young people that's coming up, the studies that you were doing. I think it's going to be nothing but great things for young folks. So I thank you for that. And I thank AIM for that too.
Thank you.